live update next. Day after First Lady Melania Trump underwent a medical procedure for what aides are describing as a benign kidney condition, the president this morning says she is recovering well. He also says she will leave the hospital in 2 to 3 days. Our White House reporter Kate Bennett, who follows the First Lady very closely, joins me now. What are you learning and how's she doing?
I think that the president is probably the most news we've gotten this morning. Certainly we have not received another statement from the First Lady's office or the East Wing or her communications director, so we're relying on the president's tweet to tell us that she's doing well. She could be out in 2 to 3 days. Of course, yesterday the statement about her procedure indicated she could be at Walter Reed for the duration of the week, which felt like a long time for medical experts, considering the procedure that she had for this benign kidney condition, as it was explained. Last night she was resting comfortably. My sources said she was the procedure was successful. During the president's visit to her yesterday afternoon, he spent about an hour with her at her side. He also visited with her medical team and the nurses and thanked them personally, and I think she wanted to get some rest, and that's when he left. Certainly he called her he wasn't there for the procedure in person, he was at the White House, and I believe that was her choosing. She is private. She did not want the hubbub of extra motorcade and Secret Service and the press pool. They really wanted to sort of pull this off without anyone knowing and respect that privacy. No one knew until the release went out that she was clear and out of the surgery and resting comfortably.
They did, and that's significant, that no one knew about this, outside of the White House beforehand.
Yeah, we heard the vice president say last night that this was a long-planned procedure, that she's doing well. I think it speaks to the very different sides of the building in the White House, and we're hearing now in the headlines about all these leaks and what the White House is doing to stop them on the West Wing side. Meanwhile, the East Wing side, which I cover pretty closely, is pretty tight. She's got, the First Lady has 10 staffers. They're incredibly loyal. It is very difficult to pry information out of them, and yesterday was a good example of that.
We wish her well. Hope for a speedy recovery. Kate Bennett, thanks for the reporting. With me now, Dr. Mohammed Allaf, Vice Chair of Urology at Johns Hopkins, and also a CNN contributor and author of First Woman, Kate Anderson Brower. Nice to have you both here. Really glad to hear that the First Lady is recovering well this morning. Doctor, what is significant about a procedure like this, and how serious is it?
Yeah, so embolization is a procedure. It's serious, but not surgery. An IV is placed in the upper leg, and a catheter is threaded into the kidney and steered to the proper blood vessel to block blood supply to an abnormality in the kidney. In a woman approaching the 5th decade of life, that's going to be either a benign growth of the kidney called an angiomyolipoma or a vascular problem, a problem in a blood vessel, both predisposed to bleeding, and given the elective nature of this, we just learned, would be preventative rather than treating an acute problem.
Given that, is this timeline for her staying in the hospital 2 or 3 more days, according to the president this morning, is that typical?
I would say it's somewhat atypical, but not out of the question. It's hard to tell without any more details. It may be just out of an abundance of caution and privacy, but certainly, staying a little longer may imply that this is a little bit more of a complex situation. The larger the growth in the kidney, the more side effects that can happen from the procedure, which would imply additional monitoring. Sometimes a second stage of the procedure is performed because the growth, for example, may have multiple blood vessels, and so they may just want to evaluate for clinical success. Clearly, they said it was technically successful, so they blocked the blood vessels that they wanted. The question is, did they achieve the desired result in terms of shrinking whatever abnormality it is?
Let's certainly hope so. Kate, to you, it's been a while since a sitting First Lady had a medical procedure in the hospital. You have Nancy Reagan, the mastectomy in '87, Rosalind Carter with the breast lump in '77, Betty Ford had a mastectomy. But you know something really interesting and powerful, that sometimes when First Ladies choose to speak about this publicly, it can have a huge impact, such as Betty Ford.
Well, when Betty Ford had her mastectomy in 1974, it was a big deal because at the time people didn't talk about breast cancer publicly, and she was one of the first people, along with Shirley Temple Black, to talk about it. And she insisted, I interviewed Ron Nesson, who was Ford's press secretary, and she insisted on the press release saying exactly what the procedure was and not just a women's health issue, which was common at the time to say. So that was a big, groundbreaking moment. There's some wonderful letters between Betty Ford and women who were going through similar treatment where she said, you know, have the procedure and move on with your life. So it was very powerful at the time, and also to the point of presidents coming for the procedure. Even when Betty Ford had her mastectomy, President Ford came after the procedure, just like Donald Trump did, because it was not, you know, you didn't want to cause this big hubbub with the president. Every time the president moves, as you know, it causes a traffic and publicity.
Completely understandable. Melania Trump is a very private person. You just heard, or Kay Bennett outlined the difference between the West Wing and the East Wing when it comes to leaks, etc. Do you expect, as someone who covers First Ladies so closely, Kate, that she will speak about this in the aftermath, that she will talk about preventative procedures like this?
Well, it's interesting that it was preventative since they have a 12-year-old son, and so you could certainly understand why she'd want to do something like this. You know, I was surprised that they were being so forthcoming yesterday with this announcement. You know, when Nancy Reagan had her mastectomy, there was no briefing, no prognosis given of how she was doing afterwards. It's really private, and she is such a private person. I would be surprised if she came out and did something really public about this.
Yeah. Kate Anderson Brower, thank you. Dr. Muhammad Allaf, thank you for the expertise. All right, back to